Hello and welcome. I am Dr. Edouard Aboian, and I'm going to talk to you today about abdominal aortic aneurysms. Abdominal aortic aneurysms are most common aneurysm of the aorta and are 15th most common cause of death in the United States. In general, aneurysm is a dilatation of the normal blood vessel, and it happens because of the ongoing degenerative process inside of the wall of the aneurysm. The diagnosis of abdominal aortic aneurysms sometimes is difficult, and the aneurysm itself is very silent. It is very important to identify the aneurysm to prevent aneurysm rupture that may lead to bad outcomes. The way we identify the aneurysms is by screening people at risk for this condition. People who are at risk are those that smoke cigarettes in their lifetime or are current smokers of age of 65 or older, and also those that have relatives of first degree with this condition. It is currently recommended to screen all male patients with evidence of smoking over the age of 65 to identify this condition at least once. As far as female patients, it is also recommended to screen them at least once in their lifetime over the age of 65 if they're active smokers or had a long-standing history of smoking. Once aneurysm is identified, it is important to consider referral to the specialist who cares for this condition. Not all aneurysms need to be repaired right away, and the decision to repair them really depends on their size. There's a component of medical therapy, and it is important to control risk factors and decrease the blood pressure. Unfortunately, there is no specific medicine that can be administered to decrease the size of the aneurysm once it's already formed. But there are multiple ways to prevent cardiovascular causes of death, and it requires work on risk factors like smoking, blood pressure, and cholesterol. In addition, there's probably 10% of population that is under the age of 65 but may have this condition. Identification is somewhat difficult because this is not a risk group category. However, good physical examination and follow-up with a primary care doctor and routine physical examination may identify this condition. In addition, current technology and especially development of artificial intelligence allows us to identify this condition accidentally on imaging modalities that are performed for different other reasons. And again, once identified, artificial intelligence and your doctor can then arrange for appropriate evaluation and follow-up. Today, we recommend to fix abdominal aortic aneurysms if they reach certain size. And that size is 5.5 centimeters for male and 5 centimeters for females. Under that size, the risk of rupture is really low, and therefore observation with adequate management and appropriate imaging is appropriate. Today, we perform duplex ultrasounds on a yearly basis for all patients that are under 5 centimeters and follow very closely to make sure that the aneurysm is not enlarging at a very fast rate. In general, we expect the aneurysm to be either of stable size or enlarged by 2 millimeters a year. If this is much faster, we will consider the repair at a smaller size. When we consider repair, there are two traditional ways of doing the repair: open and endovascular. In open repair, we have a good track record for many years, but it's a very invasive procedure, and therefore minimally invasive procedure and the vascular repair is taking over. However, there's a very unique distinction between these two procedures, and cardinally, open repair involves excision of the aneurysm and replacement of the aorta with a plastic tube, whereas in endovascular repair, the aneurysm stays there and we put a specialized stent with a fabric inside of the aneurysm to exclude them. That leaves the aneurysm in place, but not pressurized anymore, and therefore there's less chances of this aneurysm rupturing. Abdominal aortic aneurysm could be a lethal condition and very subtle. However, with appropriate screening and diagnosis and early treatment before the rupture, the life can be extended and aneurysm can be very well controlled. Thank you very much for joining me today in discussion of this very important topic of abdominal aortic aneurysm.